Hey guys, Ashley and Alicia here. We're going to be reviewing the female pelvis and perineum. So I'll go ahead and jump right in and tag the first structure for you. Go ahead and identify. This is the sacrotuberous ligament. Notice that it's coming out towards the ischiotuberosity. On the practical, always check and see if this structure has been reflected up, because there's another ligament I want you guys to identify right here. So go ahead and think about that. This is the sacrospinous ligament. So this is going to the ischiospine, which I can feel nice hard bone right underneath here. So ischiospine versus ischiotuberosity changes the name of the ligament. All right, so go ahead and identify this structure here. This is the pudendal nerve. All right, and then this structure next to it. Go ahead and identify. This is the internal pudendal artery. All right, moving right along with structures here, go ahead and identify. This is the inferior rectal nerve. So you can see that there's multiple branches of these nerves, and we could tag this anywhere along the course of the nerve. Big thing to remember for this practical is things are named where they're going. So we can see that this is the external anal sphincter right in this region, and we see a nerve coursing towards that. So this is going to be the inferior rectal nerve. Identify. This is the posterior labial nerve. You can see that it's going towards our labia majora down here, and this is a continuation of this nerve right here. So go ahead and identify if we would tag it a little bit higher. So at this point, this is the perineal nerve. The perineal nerve terminates as the posterior labial or posterior scrotal, depending on whether or not you're talking about male or female. So the last nerve that we're going to identify in this region in here, so all of this in this area is the ischioanal fossa. Identify. This is the dorsal nerve of the clitoris. Notice that it is the first inferior branch that comes off of the pudendal nerve right here. So always remember, as you guys walk up to a tag on the practical, do a sex check, make sure you're answering appropriately based on sex. All of these nerves and arteries were encased in a specialized fascia, just like this. This fascia came from obturator internus, and it formed the pudendal canal. We have removed that to expose the structures, but just understand that pudendal canal made up of specialized fascia from obturator internus. So let me have you guys identify, move some stuff out of the way, the structure at the tip of my probe. This is obturator internus muscle. So this muscle had the fascia that was making the pudendal canal. Identify this artery. This is a continuation of the internal pudendal artery. It's already given off its perineal artery right here, supplying the superficial space of the urogenital triangle, and continues into the deep space as internal pudendal artery. All right, so I'm going to move this structure out of the way and tag this right here. Go ahead and identify the structure coursing over my probe. This is the inferior rectal artery. Again, just like the nerve coursing out towards the external anal sphincter. Identify. This is the superficial transverse perineus muscle. We see the continuation of our internal pudendal artery here. And then there's another muscle that we can see laying right here. So go ahead and identify this muscle. This is the deep transverse perineus muscle. Okay guys, we changed orientations from our last view, so I want to just help you orient. So as you can see, here's our pubic symphysis here, so we know we're looking at more of an anterior view. We're specifically in the perineum, so this area that we're looking at right now, this is the urogenital triangle. So let's just go ahead and start with identification of this structure. This is the crus of the clitoris. You can see it going from superior medially down to inferior laterally. Notice that the crus has sort of a darkened color compared to, say, the muscle fibers that you see here. Always look and check and see if you can identify muscle fibers, because if there are muscle fibers over this, it becomes a different structure if we're tagging that. So I'll show you that in just a few minutes, but keep that in mind. So again, another structure that has a different color that's a little bit darker. It has more of a vertical orientation when you're referencing it to the vaginal opening. So go ahead and identify this. This is the bulb of the vestibule. So you peek down in here. I had you guys identify this already, but this is from a different view. So go ahead and identify. This is the superficial transverse perineus muscle. You can see muscle fiber, definitely a different color than these two structures here. If we did see a membrane coursing over all of these superficial structures here, which we have unfortunately destroyed in this specimen, this would be where the perineal membrane would be in this general region. We've identified this before, but again, a different view, so go ahead and identify. This is a posterior labial nerve. Again, heading out towards labia majora, coming from the ischial-anal fossa. Alrighty, we've changed orientations on you guys again. This is looking at a mid-sagittal view of a female pelvis. So the first structure I'm going to tag from this view is this. Go ahead and identify. This is the dorsal nerve of the clitoris. So we saw this in the ischial-anal fossa as the inferior branch coming off of the pudendal nerve. We can now see it as it's coming up to supply the dorsal aspect of the clitoris anteriorly. If we were to stick a pin in this structure right here, go ahead and identify. This is the corpus cavernosum of the clitoris. This is different than, I'm going to go ahead and change orientation and flip this over. So this is the crus of our clitoris, which still has tunica albuginea over the top of it. So if we tag it from a superficial surface, go ahead and tell us that it's the crus of the clitoris. If we are within the substance, so I'll show you, we flip this over. Part of this has been cut away and we're seeing inside the crus. We now identify this as the corpus cavernosum of the clitoris. Now, if we had this still attached to the pubic symphysis, this would be the suspensory ligament of the clitoris. Just know that it's a fascia-like structure that's anchoring the clitoris to the pubic symphysis, or the pubic bone. Also, if you would see a collection of fat superior to the labia majora. That would be the mons pubis. Again, we've cut that away to get to the deeper structures. Also, we spoke about labia majora here. We don't have a minora on this specimen, maybe just a little bit of a remnant right here, but just make sure you guys can identify some of the more superficial structures. Another one would be the vestibule of the vaginal opening, which is just basically the opening into the vagina. Again, hard for us to recreate on a practical setting, but you should understand and know what it is. Lastly, another structure that we were unable to locate would be the Bartholin gland, which you should see just inferior to the bulb of the vestibule, hanging out right in this area. Be glandular tissue. Unfortunately, this specimen did not have a Bartholin gland to demonstrate for the video. All right, so we're looking at a different specimen now, or actually the other half of the specimen we were just looking at. Just to orient you again, pubic symphysis is a great thing to locate. You know you're looking at an anterior view. We're peeking into the urogenital triangle. So go ahead and identify this structure here. This is the bulbospongiosus muscle. Underlaying this, or beneath this, is the bulb of the vestibule. Go ahead and identify the structure over the top of my probe. This is the ischiocavernosus muscle, and when we pull this to the side, we see a structure that has a darker, richer color just underneath. This is the crus of the clitoris. So we saw in the last example where the muscle fibers have been stripped away. Here the muscle fibers are intact. Ischiocavernosus is laying over the top. So always check and see, are there muscle fibers being reflected or tagged, or have they been removed in the specimen? All right. Next I'm going to have you identify this is a continuation of the internal pudendal artery. As we trace it up anteriorly, we see it V-ing. We see one branch here and another branch here. So I'm going to go ahead and grab this branch here, diving into the crus of the clitoris, and have you guys identify this structure. This is the deep artery of the clitoris going into the crus, supplying the erectile tissue. So this other branch, which is the dorsal artery of the clitoris, is continuing anteriorly to meet up where we saw the dorsal nerve of the clitoris supplying the dorsal surface. I want to go ahead and show you guys this structure right here from this view. This is the dorsal nerve of the clitoris, again traveling up to the dorsal surface. All right, identify the pin structure. So in a female, this is the perineal body. In a male, it is the central tendinous point. It looks like a thickening of fibrotic fascia, and its purpose is to serve as a point for muscle attachment, those muscles that we just went through. I'm going to pull this out and go ahead and identify the structure that my probe is passing through. So this is the urethral opening. We can see that this is the bladder here and the urethra right there. All right, go ahead and identify this structure. This is the dorsal artery of the clitoris. Notice that we are anterior. We can see corpus cavernosum of the clitoris right here, the dorsal clitoral nerve hanging out right here, and then we see this nice artery laying in the same area, just anterior to the pubic symphysis, heading out towards our clitoris. So next we're going to review some of the spaces that you can see on this mid-sagittal view of the pelvis. I'm going to work anterior to posterior just to help you guys remember. So the first space that my probe is passing in, this is the retropubic space. So we're just behind the pubic bone right here, just anterior to the urinary bladder. If we were to find a space on either side of the bladder, so kind of where I'm slipping my hand, this is the paravesical fossa. In between our bladder and our uterus, this is the uterovesical pouch. In between uterus and rectum, we just lay a probe right in there. This is the rectouterine pouch, also known as the pouch of Douglas. And lastly, if we were to come in and go lateral to the rectum, sort of like we did with the urinary bladder, this would be the pararectal fossa.
Hey guys, it's Alicia. So I'm going to walk you through the rest of the pelvic anatomy. So as you can see, we're inside the pelvis now. We're not looking out here at the external genitalia. We're inside the pelvis. There's a lot going on, and I know it can be a little intimidating, but just really take your time and orient yourself. Like Dr. Funk always says, find the big landmarks first. So I always find this, which would be the pubic symphysis. You can actually see the disc still in here. And then I always find this, which is the coccyx. Comes to a nice point here, kind of sharp. You can see the spinal column and spinal cord sitting in here. So automatically now I know this is anterior and this is posterior, and I can really help myself orient. So let's jump in with some of the pelvic viscera. What if I tag this right here? What my probe is going into. So just so you can appreciate the actual opening here, if you follow posteriorly from this structure, you can see it's connected to something that comes back and goes all the way up into the abdomen. This is the ureteral orifice. So we're inside the bladder. Sometimes they get really tight and scrunched up, but remember that they're distensible, so you can see all the folds where the bladder can expand. So this is the ureteral orifice. Now what's my probe sitting in? This is cut in half, obviously, but it's still intact, and you can see if I follow the path of it, it comes all the way out to the external world. So this is the urethral opening from inside the bladder. So now there's a very important structure demarcated by these two things. Obviously, since the pelvis is bisected, you can't see the whole thing, but it would be making kind of a triangle here from ureteral orifice to urethral opening to the other ureteral orifice. This would be the trigone of the urinary bladder. Okay guys, I grabbed a different specimen to show some things that are a little bit better on this pelvis, but let's keep moving on. So we just talked about the bladder. Again, find your pubic symphysis, find your coccyx, so anterior, posterior. So we talked about the bladder. Now let's move down a little bit. What is my probe sitting in? I could tag it here as well as here. This is the fornix of the vagina. So this is clearly the vagina here. What if I put something right through here? This is the external os. In this specimen, we can't really see a very good internal os, but if you can imagine this opening here in the cervix coming all the way through, there would be another os leading to the uterus, and that would be the internal os. So make sure in open lab or on your friend's cadavers you can find one of those. So what if I pin or tag this right here? This is the fundus of the uterus. So the fundus is the very tip top of the uterus. Somewhere in here in the middle is the body of the uterus. Okay guys, I've got my hand behind a structure here just to add some contrast. But you can clearly see these little leaf-like structures out here. These would be the fimbria of the uterine tube or fallopian tube. Just past the fimbria is a portion of the uterine tube that's called the infundibulum. If I tagged it anywhere in here or closer to the middle of the uterine tube and said be specific, you would call this the ampulla. And then closer to the uterus that we just talked about, you would call this the isthmus of the uterine tube. So this whole thing is the uterine or fallopian tube with fimbria, these little leaf-like structures out here that have the ciliary action. Just next to that, the infundibulum. And then the bigger portion is the ampulla, and then closer to the uterus is the isthmus. Okay, back to our original specimen. Let's continue on with some of the arteries and nerves and other pelvic viscera. Let's pin this structure right here. It's kind of covered in a venous plexus, but if you look deep in there, you can see a sheen to it. This is the ovary. One of the biggest clues is that you can see all these little fimbria of the fallopian or uterine tube surrounding it and following it back down to the uterus like this. But then beneath all this venous plexus is that nice shiny little ovary. Remember, in a lot of these elderly women, they can be pretty small, so that's the other side of it. You can see it's really just about the size of a kidney bean. So they can all look pretty different. Don't let that trip you up. Following some of these structures superiorly, you can see a couple things that we should remember from the abdomen. I have them kind of pinned here just to keep them together. So the one here, nice thick structure. This is the ureter. And then if we move on, this nice curlicue structure is actually the ovarian artery on the right. And then just next to it is the right ovarian vein. And I'm sure you guys all noticed that I said right with both of those structures. Didn't really need to say it with the artery, the ovarian artery, but I did need to say it with the ovarian vein because you'll remember that they do different things on the left and the right. So don't forget that. As I follow these connections down towards what's left of her uterus, this is a good example of what we think is a hysterectomy. You can see her vagina comes up this way and then it just kind of blindly ends in a really small, stubby little structure. This is, I think, what's left of her uterus. So we're assuming she had a hysterectomy, but she still has a lot of the structures. So coming off of the uterus, you can follow this structure that actually you can continue to follow with your eyes into the internal abdominal ring or the deep inguinal ring. This is the round ligament of the uterus. So that's pretty awesome to be able to follow all the way in the deep ring. You can actually flip this portion of the abdominal wall over and find it ending in the fatty substance of the labia majora. Okay guys, let's identify this. And now I know it's kind of tricky because this is a structure from the abdomen, but it still pertains to what we're studying now. So follow it as far as you can, and you'll notice something pretty special about it. So with the mucosa or the peritoneum overlaying this, this would be the medial umbilical fold. So now that that peritoneum is gone, this is that obliterated part of the umbilical artery. And it's really neat because you can follow it all the way down into what we're studying now. So this is the umbilical artery. Off of that we have some other arteries, like this one and this one. It's really important to name all of these for where they're going. And there can be multiple branches to some of these. So you would identify these as superior vesical arteries. And it's pretty cool because you can follow them going to the top of the bladder. Superior vesical arteries off of the umbilical artery here that continues out onto the abdominal wall, anterior abdominal wall, as the obliterated umbilical artery inside the medial umbilical fold. Oh, look here. There's another little superior vesical artery coming off of it. So another really important relationship as far as arteries go is this relationship. So really take a look at what's around and identify this. This is the uterine artery. The biggest clue that it's the uterine artery is that this structure that we already talked about is going right underneath it. So this is that famous little mnemonic or phrase, water under the bridge, water for urine. This is the ureter that we can follow all the way up. Slips right underneath the uterine artery. And we can also continue to follow the ureter to the back of the bladder here that we already talked about. So make sure you really just take a nice long look at some of these things, follow them as far as you can, and it will really help you. So we can follow the uterine artery all the way back. Now if I move the ureter out of the way, we can follow it all the way back to this bundle of arteries. Say this, right where my probe was sitting, was more of like a common trunk. What would you guys identify that as? That would be the anterior division of the internal iliac artery. I know I really don't have a true division here, but really all of these arteries come off that anterior division. So we would wrap a string right around here, and that's what you would call the anterior division of the internal iliac artery. That would make this then, well, you guys know, I don't have to grab it completely. This is the posterior division of the internal iliac artery. And I know it's a pain, but it's important that you say all of those words, especially the division. It's not branch or trunk, it's division. So let's continue. Identify this. And in order to do that really well, I need to give you a good window here. So follow it with your eyes as best as you can. I know there's a lot of stuff in the way. In a practical situation, we would set it up much better than I'm struggling to do right now. So I can follow this under here, going to what seems to be the bottom of the urinary bladder. So this little portion would be the inferior vesical artery. And I believe this branch going even more inferiorly would then be the middle rectal arteries or artery. Remember that all of these guys branch as they feel necessary. So you could have multiple little branches to any of these. Don't let it trip you up. Really just name them for where they go. Okay guys, identify this. So if you take your time and really look at where this structure is going, you can follow it all the way down out this hole. That to me is the biggest clue that this is the internal pudendal artery. And it's kind of close to this. So I could see where this would be tricky. Let's identify this quick and then we'll discuss why they're different. This is the inferior gluteal artery. And I know you're saying to yourself, wait a second, Alicia, what are you showing us? This is coming off the posterior division of the internal iliac artery. That's not what it's supposed to do. And you're absolutely right. The inferior gluteal artery should be one of the last branches off of the anterior division of the internal iliac artery. However, bodies do what they want. So it's still fair game, and it's still fair game because they're going in completely different spaces. This inferior gluteal artery is going straight out through some musculature towards the posterior like gluteus region. This structure, this artery, the internal pudendal artery, is exiting a very important opening. So my probe and the artery are going through what structure right now? This is the greater sciatic foramen. And you know that because all of these nerves underneath here are coalescing and running through the greater sciatic foramen to get out to the posterior leg. So that's your biggest clue. Now let's identify these. I could tag this structure here, I could also tag it here, and I could also tag it here. And you would say the same thing for all of them. These are lateral sacral arteries, clearly coming off where they're supposed to, the posterior division of internal iliac artery. There's another weird artery in this specimen. I'm going to try and get everything out of your way. Coming off the posterior division and heading out under here, continuing over here through this obturator canal. This is the obturator artery. And again, you guys are going to be yelling at me, I know, because it's not coming off where it should, but that's okay. They're still fair game because clearly it's going to a very unique place going through the obturator canal. It's the only artery that does that. No matter where it comes from, you're going to call that the obturator artery, even if I tag it under here or closer to the posterior division. You're going to follow it with your eyes and confirm what it does, and that's how you'll name it. Okay guys, let's get into some of the last few arteries that you'll need to know. I've pulled away the common iliac artery here that I'm pinching with my fingers to try and get you a good view of this. So hopefully you can see when I pull the common iliac vein up like this, that in here, this branch that I'm pointing out with the tip of my probe is coming off of the posterior division of the internal iliac artery. So what is this? This is the iliolumbar artery. Now let me show you why that makes more sense. If I pull the common iliac vein down like this, you can now see this artery has a couple branches. One right here that goes straight out towards the muscle that it supplies, the iliacus muscle, and one that travels straight superiorly to supply the psoas muscle and some of the lumbar vertebral column. So that's why this artery gets its name, iliolumbar. Okay guys, identify this. So this might be a little tricky, but that's why I wanted to showcase it for you. This is a hypogastric nerve. And let's kind of go through why it is that. So if we follow this up, we can see whatever it was attached to is actually cut right here. But you can continue to follow this little fiber and see that it would eventually come up like this to lay kind of right on the sacral promontory and in fact go even further. So that would be your clue that this is a nervous structure that lays right here. So it's the connection or the continuation of that structure that lays here, which is the superior hypogastric plexus of nerves. So that plexus continues down into the pelvis as two structures, two hypogastric nerves. So this would be the right hypogastric nerve, and then the other one, of course, would be on the other side. But since we've bisected the pelvis, you can't see it. So the hypogastric nerve continues down into the pelvis to supply the autonomics to the visceral structures of the pelvis. So if I grabbed any kind of fiber or mess of nerves in this area, what would you identify that as? This would be part of the inferior hypogastric plexus. So the hypogastric nerves continue down and then branch out as the inferior hypogastric plexus to make their way to all of the viscera that they need to supply autonomics to, like the rectum, the uterus, or what's left of it in this case, and even the bladder. And it creates all little plexuses on top or around those different viscera. So I'm going to move that hypogastric nerve out of the way to get to some of the rest of the nerves that we need to know. What's this structure here? This is the lumbosacral trunk. So this is what brings L4 and L5 to meet this whole thing collectively. So let's identify from here to here. If I wrapped a string around this entire nervous bundle, what would you call that? This would be the sacral plexus. So the lumbosacral trunk brings L4 and L5 ventral rami down to meet the rest of these. That becomes the sacral plexus. So that would make this S1 ventral ramus. This would be S2 ventral ramus, S3 ventral ramus, and S4 ventral ramus. Together, plural, they are rami. And again, like I mentioned before, they're all coming together as the sacral plexus to exit the greater sciatic foramen to make its way to the posterior leg. Let's get in here and look at this nice tiny guy. There's a couple of them here. There we go. So this is kind of an elusive little structure. This is a pelvic splanchnic nerve. And the reason why I know it's a pelvic splanchnic nerve is because it's coming from the sacral rami, these two in this case, they're probably one from each joining, and it's heading straight to the inferior hypogastric plexus. So it's really important to remember that pelvic splanchnic nerves provide parasympathetic or sympathetic, parasympathetic innervation to the rest of these viscera. So a second order question would be what fibers are contained in this nerve or this structure. And you would answer preganglionic parasympathetic fibers, because you guys all know that the postganglionic parasympathetics are located in the walls of the individual organs. So that's a pelvic splanchnic nerve. What's this guy? Another little elusive structure. This is a gray rami communicans. And we can tell that it's a gray rami communicans because we can see this structure here, and it's coming off of that. So let's identify this too. This is the sympathetic chain. So as we follow this down, right from a little ganglion of the sympathetic chain is something coming off of it to connect to, this would be S2 ventral ramus. That is exactly what rami communicantes do, but in this area we know we don't have any white rami communicans, so we have a gray rami communicans here. Now, the only other structure in this area that I feel would be necessary to explain, it's one of the last nerves on your list, is a sacral splanchnic. Also pretty elusive, but it's very different from a pelvic splanchnic because it would be coming off the sympathetic chain here, kind of like this guy, except it would be traveling to meet with the hypogastric nerve, shooting in like that, to then supply sympathetics to the inferior hypogastric plexus and then all of the individual visceral plexuses. So it wouldn't be going into the S2 ventral ramus, it would be jumping onto the hypogastric nerve to then continue and supply autonomics like the pelvic splanchnics jump onto. So now let's open everything up and look in here, some of the deeper structures. Hopefully you can see okay. Let's identify the pin structure. This is that all-important, very, very prominent muscle, obturator internus. You can see the nice muscle fiber. There was super thick fascia overlaying it. Okay guys, I've kind of moved some things out of the way, but think about what we just identified, and now you can see what my probe is piercing. Let's identify this structure. This is the arcus tendinus, or the tendinous arch of obturator fascia. This is that thick specialization of fascia that the pelvic diaphragm muscle is attached to. So you can see it sweeping across like this. Okay guys, we had to switch the angle of the camera a little bit, so now we're looking kind of superior to inferior so that we can show you these structures. They're pretty deep in the pelvis, so I apologize if the picture doesn't come out light enough. But let's try and identify what my probe is sticking into here. So in a practical, you would be able to get your head right in here and look, and you can see these nice muscle fibers going straight to the tip of the coccyx. This is the coccygeus muscle. Now if we look even farther down here, you can again see some nice little muscle fibers sweeping kind of the same direction. Don't be specific on this one because I really don't think you would be able to anyways. Just identify it broadly. This is levator ani. So remember, there's 3 little muscles in here, but unfortunately, the way this cadaver was composed, you can't really tell the difference between puborectalis, pubococcygeus, and iliococcygeus. But I know there are some examples in some of the disarticulated pelvis, and in open lab, I'm sure we'll be able to find a couple good examples. So grab one of us and we can totally show a better example to you. However, it is possible that you could identify this just as levator ani. So really get in there and look for those muscle fibers and make sure you can see the direction of where they're going. And again, just to illustrate one more time, this is that really nice arcus tendinus, or specialization of obturator fascia, the tendinous arch of obturator fascia that all of these muscles attach to. Alright guys, that's it for our section of the female pelvis and perineum. We hope it helps. As always, please don't forget to check out Kelly and Charlie's video of the male pelvis and perineum. And definitely remember to orient yourself every time as best you can, and take your time, follow things with your eyes, name them for where they go. But most importantly, we're not always perfect. We definitely don't say things exactly as they are on the list sometimes. We apologize for that, but make sure you double check the checklist.
And another thing guys, make sure you do a sex check on all the cadavers when you walk up to the tag, just to make sure you identify the structures properly. Make sure you go through your checklist a few times, comparing the terminology that we used in the video with how the structures are listed in the dissector. I'd hate for you guys to lose points just because we call something a little bit different than what you might be expected to know. And always compare what we have talked about in the video to the lecture notes as well, to make sure you're getting the most valid information. Hope this helps guys. Good luck. This will be the
Vesicle. I don't know that I have a good one. Maybe that's what this is, that got like completely obliterated. Oh.